Welcome to our Lunch and Learn here at White Pine Center for Body Awareness Week. I'm Brandis Montgomery. I'm the Clinical Director for White Pine Center for Healing. What we're going to be talking about today are the 3 stages of treating an eating disorder. This is basically a way to think about and conceptualize how to treat an eating disorder in these different stages because each stage is different and has different needs depending on the client. So ultimately, when we have a client come into White Pine, we do an intake with them, and that's where we gather all the information that we need as to what they're currently experiencing when it comes to their disordered eating. So, in this time period, the clinician is sort of formulating in their mind where they're at as far as their treatment need. And a lot of people are all over the place when it comes to the severity of having an eating disorder. So you can be significantly underweight, maybe under the anorexic category of diagnoses, or there can be a binge purge cycle that is happening pretty frequently on a day-to-day basis with a certain client. Or there could be a lot of binge episodes happening in a weekly basis with a client. Those are the 3 top most popular eating disorders, which is anorexia, bulimia, and binge eating. But with that being said, each can have their own different severity levels. So, what we want to first do in the first stage of treating an eating disorder is make sure that there's immediate medical stabilization if needed. So, when we're looking at someone who's coming in who's significantly overweight, who's having trouble getting daily nourishment, then and they're maybe experiencing some physical symptoms like lightheadedness, dizziness, heart palpitations. Those are some things that are red flags that we know they need a higher level of care. A higher level of care meaning maybe residential treatment or inpatient treatment, which is hospitalization, to make sure that those symptoms are taken care of before we can actually do therapy with that client. We want to make sure that their mind, their emotions, and their body are in the right place. Hence why the first stage is to see, okay, what stabilization needs to happen. We're also looking at breaking maladaptive behaviors. So this could look like a binge purge cycle that has gotten out of control. And the thing with purging or laxative use is that it's draining the body of the electrolytes that we need. And that could actually be very deadly. So we want to take this into consideration. Hence, again, we need to make sure that they're stabilized. So, this first stage of treatment is really all about the severity of what that person is going through with the disordered eating and making sure that their symptoms are stabilized and that we're breaking any sort of maladaptive behaviors. And that could really vary time wise. Every client is different. It could take a month, it could take a couple of weeks, or it could take 3 to 6 months. Again, it does depend on the client's severity. So then we move into stage 2. Stage 2 of treating an eating disorder really looks like maintaining that stabilization, making sure their mind and their body are functioning properly, because this is where we dive into therapy in helping that client gain the coping mechanisms that they need so that they don't need to rely on the eating disorder as a form of coping with whatever might be happening in their life, whether it be school or work or family or marriage. It could be all over the place. So we want to look at stage 2, which to me is the longest stage that someone would be in, because we're really trying to establish normalized eating and nutritional rehabilitation, making sure that that is really practiced on a daily basis. We're challenging eating disorder related thoughts and behaviors and introducing those healthy coping mechanisms. And we're really getting into the nitty gritty of therapy. We're really diving in there and we're trying to figure out um, where all this came from. I will talk about the perfect storm maybe in another video. But with that being said, stage 2 is really trying to get in there, get those healthy coping mechanisms. while also trying to build awareness as to where did the eating disorder come from? Why do I need it or feel like I need it in order to handle my day-to-day life? And then the third stage, this is more continuing that stability. But the third stage, we're really addressing the body image issues. So, one myth that I feel is out there is that because eating disorders have a tendency to be misunderstood, that if someone comes into therapy, that's all we're really looking at is let's get them to like their body and to feel comfortable in their body. And then that is the main part of therapy. When in reality, there are a lot of factors that affect a person who has developed disordered eating. So we treat body image issues in the third stage because if you think about it, if someone is very malnourished and that they're at the low end of their weight and they need to, excuse me, they need to get up into a healthier weight range, their body's going to change in the midst of that process. And so it does not make sense to go in and hit the body image work hardcore in that first stage because their body's going to be continually changing, which, yes, is very uncomfortable. But we want to make sure, again, that their physical body is stabilized and that their mental health is stabilized so that as they're going through these bodily changes, then when they're stabilized, have the healthy coping mechanisms in place, they've processed through some trauma, then that is where we introduce a lot of body image work, sort of that last piece of the puzzle ultimately, so that they can lead a healthier life inside their body and feel comfortable in their body. This is also a time period where we introduce food challenges. So, a lot of the time in eating disorders, there are certain foods that might be off limits. Either it triggers them into a binging episode, or they're just foods that are so uncomfortable they will never eat them. And so, what we do in this third stage of treating an eating disorder is we will probably make a fear ladder of different foods, and we challenge that client to make sure that we're slowly integrating harder foods into their nutritional basket, I guess, and making sure that they feel comfortable with that anxiety. And then, of course, we up the ante. So we will start them with foods that start maybe like triggering a 1 or a 2 on the anxiety scale, and what those foods might look like, all the way up to about a 10. What do those foods look like? A lot of the times that would be like fast food or sweets like ice cream or cake or cookies or something along those lines. But again, everybody is different. And so the food ladder, the fear ladders or food ladders, they look different from client to client. Same with the body image work. A client might not like their entire body or parts of their body. And so there's different things that we can do to help them learn first how to just accept their body. And then we move into how they can learn to like their body. And then hopefully we can move into loving your body, which can be a challenge. Again, that's why we save this for stage 3 rather than diving into that body image stuff in stage 1, because their body and their mind are not ready for that type of work, because there's so much other groundwork, foundational work that needs to happen first in order to have successful treatment. Um, with that being said, in order to have someone stabilized, there are different levels of treatment. We call them higher levels of care. And I'll briefly go over those just so that stabilization can look very different in each stage of, each level of care. So at the highest level, ultimately, is inpatient. Inpatient care is where you are able to go in as a client and have your medical needs 100% met because it's usually housed in or near a hospital, so that if a medical event were to happen, that client could be treated right there on the premises. The next level down, a step down from inpatient, would be residential. This is where the client will go, they will sleep there, eat there, they will basically live there, residential. And they are immersed in that um, recovery type of environment. So every day they will be facing the challenge of meals and foods. They will be doing a lot of group therapy. There usually is an individual therapy once or twice a week for each client. There's family therapy normally included into that. You will also see a nutritionist, dietitian, and you will also see a prescriber as well to make sure that their treatment is all encompassing and we're looking at stabilization from every aspect. That's residential. The next step down would be like a partial hospitalization or like a day program to where that client, they don't have to sleep there overnight, but it is what it sounds like. It's a day program where they will go from breakfast to sometimes like dinner. Some programs vary in the times that they offer a day program or a partial hospitalization program, but you're still immersed in, the therapeutic element of lots of groups, individual counseling in those time in that time period too, with partial hospitalization. The next step down after that would be IOP, which stands for Intensive Outpatient Programs. That consists of 3 days a week for 3 hours. So the client has graduated from either inpatient or residential, has completed a partial, and then is stepping down into IOP. So as you can see, the intensity is lessening because there's stabilization, hoping that the stabilization will be there so that they're building these skills on their own and they don't need that higher level of care, that they're gaining stabilization physically, mentally, and that they can really start to dive in therapeutically. What is going on? How did they get there? And then creating healthy coping mechanisms, like I mentioned before. And then also establishing a plan for relapse prevention. And then at the lowest end of the levels of care is simply outpatient. Outpatient level of care means that you're meeting with a therapist one-on-one on a weekly, bi-weekly basis. You can incorporate a group if that facility offers it. Group therapy has been very successful in treating eating disorders. It just depends on what the groups are. It can just be just a general group, general processing group, or some have different themes, like an intuitive eating group or something based upon a curriculum. So outpatient again is the lowest, least restrictive type of treatment, and that is where you're just seeing a therapist one-on-one. That's what we do here at White Pine Center. So we have our therapists who are trained in eating disorders, and they're seeing our clients one, maybe twice a week, depending, and really working through whatever it is that client needs to, again, maintain that stability, learn those coping mechanisms, and sort of dive into the awareness and understanding of where the eating disorder came from, treating any trauma that is a part of the perfect storm that created the eating disorder. There's a lot of things you can do in outpatient. Now, if a client starts to slide backwards, and that's not unusual, sometimes a client needs to go into a higher level of care multiple times just in how eating disorders operate. They hijack the brain, and it can be very difficult to get it on your first try with how that eating disorder has affected the brain. So, with that being said, at the outpatient level, that doesn't mean that if someone's starting to slide back and they're destabilizing, that we would recommend them ultimately to go into a higher level of care, to immerse themselves in more intensive treatment, and then when they're stabilized again, they can come back into outpatient care. You see this formula essentially in other forms of therapy, meaning like drug and alcohol. Drug and alcohol therapy follows the same model of higher levels of care, depending on what that client needs stabilization wise. We do the same thing here in eating disorders. So really, it's not something that is just eating disorder specific. But we definitely need that higher level of care and the step up, step down process just with how eating disorders operate. So again, just to bring us back to what the 3 stages actually are. The three stages that we here at White Pine Center sort of keep in the back of our mind when we're treating someone with an eating disorder is first, if they need immediate stabilization, mental health wise or physical wise, we're going to offer a recommendation for high level of care. That's first and foremost, along with breaking any maladaptive behaviors that might be happening that is going to hold a client back from gaining progress in therapy. The next stage will be maintaining that stabilization, like staying in a healthy weight range. And then we're going to create those healthy coping mechanisms and dive into the understanding and awareness of the disordered eating. And then the third and final stage would be working on the body image, along with any food challenges if we need to do those types of things. So, those are the 3 stages of how to sort of conceptualize how to treat eating disorders and sort of how our approach is here at White Pine Center for Healing. So, I hope this was informative for you. If you have any questions, please don't hesitate to visit our website, send us an email, comment below in any of the comment sections of where this video is going to be posted. And we'd be happy to answer anything that you may need. Thank you so much for sitting with us and doing our lunch and learns during Body Image Awareness Week. We really appreciate it. Again, I'm Brandis with White Pine Center, the clinical director. Thank you so much for tuning in. Bye.